Hey, we are Dr. Shane and Liz Watt, and welcome to the Be Healthy Naturally podcast.
We are doing this podcast because we are trying to bring knowledge and education to create a new way of thinking about our health.
Knowledge is the key to live a happy, healthy life, and our goal is to help you live your best life.
Thank you for being on this journey with us, and we hope you enjoy this episode.
Dr. Paul Larsen's goal is that you experience personalized dental care that prioritizes your overall health and well-being, benefits from advanced, minimally invasive techniques that support your body's natural healing process, with expertise in biomimetic dentistry, regenerative surgery, and more. You can trust in a holistic approach that aligns with your health goals. So, welcome.
Welcome to the podcast,
Yeah,
Doc.
welcome today. And
Thank you.
When people start going down the rabbit hole of trying to take care of their bodies, they soon realize how important their dentist is and the techniques that the dentist do, because as we know, so much infection can be in the mouth that can affect the body. So today we're going to talk all about the infections and how the infections affect you.
But not just regular dentistry, about a natural approach to dentistry, which is generally referred to as biological dentistry.
So
Yeah.
Dr. Larsen,
Yeah.
do you want to tell us a little bit about you and how you came about to what you're doing and what you're doing now?
For sure. So I grew up in Logan. So I'm a Utah native, grew up there, went to Utah State. My dad is a retired endodontist. He just retired a couple of years ago. So as we talk, you'll understand that he and I don't talk about how I truly feel about root canals, because that might write me out of the will.
Because that's what he did for 40 years.
He did for 40 years, and he still talks. Every time I see him, I saw him Sunday and still talking about root canals, and he's been retired for 4 years. And I just say, Dad, I just don't have time to do them. They take too long. And so that's where we leave it. That's where we leave it. But so I practiced traditional, we'll call it traditional dentistry, for probably the first eight-ish years of my career. And here in a couple of weeks, I'll be 23 years in practice. And stopped placing amalgam or mercury fillings early on. I just didn't like doing them. I just didn't like the material. And then
You mean going back into the lab and mixing them yourselves? Because that's what she did. She literally did that.
Right.
When I was in chiropractic school, she was a dental assistant, and she would go
Okay.
back to the back room and pour it in and mix it all together. And
like in little pill.
okay, but still,
Never
we
need-
wonder why she's had some health issues along the way.
Yeah, for sure. So I never experienced that. I did find a dropper bottle of pure mercury in my office when we remodeled it, in the office that I originally bought.
Yeah.
And a
That's
dropper
big enough
bottle.
for a hazmat right there.
Oh yeah, because and that is the densest eyedropper bottle you've ever picked up. It is so heavy.
Wow.
So yeah, that was.
Did you put it in a
kinda where
case and encase it and put it on your wall?
No, I gave it to the sales rep who sold it to the original doctor and said, "You get rid of this. I don't want to see this ever again."
Oh, geez.
So yeah, so we kind of started there, and then in 2011, I decided to do an Ironman triathlon, and I knew I needed all the training, right, the physical training, but I also needed to get my nutrition and supplements figured out. And Dr. Judson Wall is my neighbor, has been my neighbor most of my practicing career. And so I
Neighbor
started
in
picking his
practice or
brain.
neighbor in
Neighbor in practice.
Okay.
Like literally we shared walls for a
Gotcha, okay.
while, and now we're half a block apart.
Okay.
He lives in Bountiful, I live here in Bountiful as well, so we're pretty close. But so I picked his brain, and that was the start of, standard process, doing all of their certifications. And initially it was for myself. I wanted to be healthy. I wanted to do as well as I could in this Ironman and support my body. And then it trickles to your family. Then it trickles to your, like, why am I not doing this for my patients? And then it becomes, IAOMT, certification in safe mercury amalgam removal, then ozone, and then then cavitation or CSR surgeries, and we'll talk more about that, and removing root canals and not ever doing a root canal again. And that's where my dad, that's
So
when I
you
stopped
went
doing root
down, you
canals.
started going down the rabbit hole because you wanted to become better at your
So
triathlon.
basically, something that was going to be really stupid to do, you got really smart from.
Yes, yes, yes. That's exactly
How
right.
did you do in the Ironman? Let's just get there.
So since then I've done that was my first. I've done three. That was the best I've done. Was the
Oh my
first one. I
gosh,
finished.
that's
I've
insane.
finished three, um,
Good for you.
and loved it. A lot of fun. I still ride my bike a lot. That's so I do the Logan to Jackson bike ride every year. I think I've done 15 or 16 times
Is
that.
that the
So
loaded Joe or something like that they call it?
Loaded, yeah, yeah. So I'm hooked on endurance events, and that's the one that I stick with.
So crazy
But
enough,
yeah, that
I had a patient that actually saw a guy get killed on that.
yeah, it happens.
He turned, he didn't make the turn and went off a cliff.
Oh,
Yeah, it was a few years ago. Yeah, kind of crazy.
yeah. There's been a couple of somebody went over the one of the bridges into the river and didn't
Yeah.
survive that, and yeah, it's can be scary. So,
Not to put a downer
um,
on it, sorry.
yeah, exactly. So yeah, so that's where it started for me, and then um, about well, how many years ago? 10-ish years ago, I moved into a new building, and that's when I left all the root canal stuff. That's the last time I did a root canal. We've moved into ceramic implants, offering ozone therapies, a lot of airway treatments. We have the cone beam machine, X-ray unit, so we can measure airway and see how people are breathing, see what expansion will do for them. So yeah, we offer all of it, all those things, from for kids up to grandma. So it's
So
great.
when we talk about infections, because you know, what talk to us about what the leading causes of infections are in our mouths, how we take care of them, and what people can do.
So the first place it starts is gum disease. If someone's not brushing, flossing, taking care of their gums, just the over everyday stuff that we should be doing, that's the first place it'll start. So, you know, and if you ask me, a toothbrush should be soft or extra soft bristles. Don't buy a medium one at the store because you're gonna just damage your gums. Ultrasonic, like the Sonicare or an Oral-B, are great. Let those do the work. You don't have to do a whole lot when you're using one of those mechanical toothbrushes. And then flossing, and flossing thoroughly but gently. You know, we call it repentance flossing because patients will floss the night before and they really get after it, and then they come in and their gums are all flared
All
up, and,
swollen
and
up
you know what's happened, right?
because they
So
wanted to be the
so
good patient and come in
yeah,
and
they wanted to floss at least once
That
since
would
their
probably
last
be
cleaning.
Shane.
yeah, my wife here, man, doesn't go to bed
Yeah,
without flossing every night,
there you go.
as for their dental system background. And I'm
Yeah.
horrible at it. I'm horrible at it. But
Yep, he is.
but I've got really
So,
good teeth. I have only a few cavities in my life and she's had a whole bunch.
that happens for sure. So that's the first place it starts, and that's gingivitis is reversible if you up your care, up your maintenance. You can reverse that. Then it evolves into periodontal disease, and now periodontal disease, we start talking about how is that affecting your heart or diabetes or inflammation. And once you have periodontal disease, now you're losing bone and the support around the teeth, and that's a permanent loss in a lot of cases. Now it's a rush to stop that from progressing anymore, and saving the health of the teeth and saving the systemic effects of that bacteria getting into your bloodstream. Um, so many studies that show that bacteria is in all the blood, in most of the blood clots. They isolate oral bacteria in almost in a huge number of the blood clots that are found.
Blood
And then
clots found anywhere or blood clots found in
anywhere,
the Oh, okay. Interesting.
anywhere. Yep, systemically. And so that's why it's such a huge concern, systemically, and for the heart health and the inflammation that it causes. So now it throws your diabetes out of whack, and you can't maintain your diabetes balance, your blood sugar balance. Um, And then, obviously you start talking about a tooth that's infected, and that starts either with trauma or a series of cavities that start small, and then you get a bigger cavity in the same tooth, and that filling breaks down, and now you have a larger cavity, and eventually you get a nerve that's got irreversible damage, and you have to make a decision between, do you take it out or do you get a root canal? I would say get it. There's one or two situations where getting a root canal temporarily it makes sense, but um, taking it out to avoid having a dead tooth left in your body, and that low-grade infection constantly in your body that your body is having to manage. Other sources of infection are old root canals. Maybe see those as much as anything in our practice. Um, everybody's, how many people have had root canals because that was what we did, right? That was what dentistry was. Like, save the tooth, do a root canal. But in 10 to 12 years, that's going to fail, and you're going to have a new infection because you can't clean that tooth, and the body, you can't clean it when you do the root canal, and the body can't keep it clean afterwards. And so eventually you're going to get a new infection.
Is that 100% guarantee? Basically, if you have a root canal, that there's going to be infection in there eventually?
I think there's a study in the Hidden Epidemic that Dr. Dr. Levy's book, 5,000 teeth that had been treated that had root canals, whether they were symptomatic or not. 5,000 had pathogenic bacteria when they were
So
extracted.
basically every single one then.
Yeah. It's just a matter of time until they manifest symptoms. So, and so
each
for
tooth,
me,
each tooth also has this, because I remember in something somewhere along the way that I did, a course that I did, that each tooth actually has an affinity to a certain part of the body and a certain organ and different
right.
things. Correct?
Yep. The meridians. So now we're in a little bit of the Chinese medicine. Each tooth has, yes, a connection to part of the vertebrae, part of the spine, certain emotions,
Well, and
you know,
organs and things like that
and
too, right?
organs and different systems. So some might affect the endocrine more than others, and some are there's definitely a relationship between breast cancer and where you have certain root canals.
Really?
And so that's lower premolars and upper molars are on that meridian for breast cancer. A lot of these lower anterior ones are, and the upper anterior are on the urinary tract and kind of that part of the system. But yes, there is lots of that connection through the meridian. So, and then there's infection sites, and we were talking a little bit about some courses that I'd been to with Dr. Gennady from Germany. He in the lingo we talk about cavitations. He prefers to call them SAR, which he says is a covered socket residuum, meaning there's
And
a leftover socket
Yeah,
space.
explain
and
what.
so that is, well, from me with being in dentistry for 4 years,
Oh,
dental
yes.
assisting.
Yes, ma'am. What can we
Mhm.
learn from you?
Yeah.
No, but I know that's usually that's what happens when you get your wisdom teeth taken out,
Yes.
right? And
Wisdom
so
teeth.
almost
Mhm.
anybody that has that, they can have definitely underlying infections because of tissues or whatever that were left behind.
Mhm. It's actually the way the body heals. Any extraction, and Dr. Gennady has shown this in some of his several studies, that any tooth that's taken out, if it's not cleaned and grafted properly, will end up with a bony lesion. We don't know what's in there until you biopsy it, so it's hard to give it a name, but that's why he calls it a covered socket residuum. The top part, the part closest to the mouth will heal, but there'll be a pocket of unhealed bone. And yes, there's all sorts of things hiding in there.
And a cavitation is basically like when you see the X-ray or the cone beam, I guess is what you use. Like it just seems like there's just a hole, like there's just like looks like a hole in the jaw kind of thing, right?
Yeah. So there's a cavity, there's a void, very weak bone or no bone in the area. Okay. So yes, the cavitations and I'm going to say that kind of in air quotes because it's I don't know that that term is going to change over time. You're going to see that will change to this socket residual socket space because we don't know what it is until you biopsy it. You know, it might be fatty degenerative tissue. It might be parasites, bacteria, virus. I mean, osteomyelitis is what they're actually finding in most of them. And those studies are going to be coming out in the next few weeks from Dr. Gennady in Germany. So
Now, do you think that's going to hit mainstream dentistry as well, or does that take a while? Like, are you guys like the front end of all that kind of stuff in the biological dentistry world, and then it takes a while, because
mhm.
same kind of thing like in the functional medicine, right? The
Yep.
doctors that are doing functional stuff, it seems like they get all that science way
Well,
before
they knew about
standard.
the mercury, the amalgam fillings way before, and it wasn't until like I remember when I was a dental assistant, 30 years ago, that
Hmm.
we were still using amalgam, but the dentist was starting now to be able to start to use
The
Composite.
the
yeah.
composite. Yes.
Well, that's
And
because
Hmm.
so,
well, honestly, the AMA couldn't come out and said, "Oh, by the way, we screwed up," because they would have been sued out of their minds. So
Yeah,
they
it's
still,
there.
I think
There's
my
a
understanding is they still have never actually came out and said anything that they can cause issues. Is that correct?
the
I could be wrong on that.
2 or 3 years ago they came out. The ADA came out and said there are vulnerable populations, which are young kids and pregnant women,
Uh,
to the mercury fillings, and that's something that you should really watch placing in there. It's you can still place them. In fact, here in Davis County, there's a doctor who will take out your composite fillings because he thinks they're destroying your teeth and put mercury in for you.
oh,
oh, nice. Yeah.
Yeah, yeah,
Yeah.
it's great. And so yeah, they're still being placed. Just recently they banned them completely in Europe. So Europe, as usual, is ahead of us in a lot of things
Well, the
health
crazy thing
wise.
is how did anyone think, oh, hey, why don't we put mercury into our
Hmm.
mouth? Like, who came up with that whole concept and how did that even fly? That's the craziest
Well,
thing.
yeah, the history is kind of crazy. You know, initially they yeah, it was kind of the only thing they had. You know, it was that or gold. You know, they didn't have the plastics and the other things to work with. So
Uh,
part of it was just kind of necessity. And yeah, the whole history, you were a quack initially if you said we shouldn't be doing this. And then it evolved to you're a quack if you're saying we shouldn't be doing this and we should be taking them out. So
uh.
it's totally flipped.
how
Like a
can
lot of things happen.
how can you know if you are experiencing a cavitation for the
So it's hard to know, like very rarely are they painful. So most people won't feel pain. Oftentimes it's digestion because those areas are connected to the digestive tract. Fatigue, not healing correctly from other things that you're treating. Like doc, maybe you're treating somebody and they're, you know, your treatments aren't working as well as they should. Their body's inflamed from something, and maybe it's coming from a cavitation or an oral infection that hasn't been diagnosed or treated. And so there's always symptoms. It's not as easy as an infected tooth where you tap on that tooth and you're like, oh, that hurts. It's more tying experiences and health history and other whole body symptoms together.
well, if you think about it, how many people have had their wisdom teeth out? I mean, it's just become common
Hmm.
procedure right
Yeah.
now. And I don't know necessarily, like they say it's for crowding, they say that it can cause later on infections. Like, I
Hmm.
don't, we just know what we've been told, and who knows really
Hmm.
what is true. Like, do you believe in taking out wisdom teeth then because of the science and stuff that you see now?
So there's I had a patient today. She's got to be late 40s, and her last wisdom tooth finally erupted through the tissue.
Oh,
And so she's got two of the four cusps poking through the tissue. And so at that point, yes, you need to extract it. So this is my belief, and there's a lot of debate on this. I don't think the wisdom teeth cause the crowding. So or orthodontists will say, "Oh, you got to take those wisdom teeth out because you're going to mess up my orthodontics that I did." I don't think that's the case. If you can take a cone beam and that wisdom tooth is pushing against and causing a problem with the tooth in front of it, then yes, you should have it extracted.
Well, isn't that
If
kind of the
that
thing
was
with the wisdom teeth? They're when they take X-rays, aren't they? A lot of times they're really funky directional compared to all the other teeth.
yes,
Is Do we have any
yes,
idea why?
uh, we are de-evolving because of our diet. Our mouths are shrinking,
Wow.
basically.
Okay.
So, Weston Price showed in the 50s and 60s that if you can find a population that doesn't have a Western diet, they've got room for all their teeth.
Oh, they have bigger
But
mouths
as
then, huh?
they had bigger mouths, yeah. So we run into so for us in this area, you run into some of the Polynesian people that have recently come from Samoa or Tonga, and they've had these big, huge, broad smiles, and they've got 32 teeth, and they probably have spaces between those 32 teeth. But as soon as they start eating our crummy Western diet, they start getting cavities. They don't have room for wisdom teeth, and now that their kids, 2 or 3 generations later, have crowded teeth. And so it's an evolutionary thing. So, but yes,
Interesting.
they can be coming in very funky directions as long as they're not impeding or pushing on the tooth in front of them, and they stay completely covered, meaning there's not a an entrance to them through the gingiva where the bacteria and there can be things passing back and forth. Then that's fine to leave that wisdom tooth. But once it breaks through the tissue and there's a communication, you got to do something with it.
So
So
And or if it
why
starts
is
hitting
it that
that,
you have to as soon as it breaks through?
yeah, because you had all these other teeth that broke through it at one time or another.
because only part of it's going to break through. So like this patient only had maybe a third of her tooth has made it through the tissue, and she's got a flap of unconnected tissue hanging out on top of that. So she's
Oh,
going to get an infection underneath that.
so
If it were to
it
erupt
usually
all the
doesn't
way
go all the
through,
way through. Okay.
correct, because there's not room back there. If
Okay.
it would erupt all the way through, no problem. That's great. But if there's only partial eruption through the tissue, then that's where the problem comes.
But for the people taking out the wisdom tooth, they like it's harder to get the wisdom teeth out if it's already erupted through, right? Because then it's gone into the bone and everything's kind of set into the bone as much, right? Before it's kind of not as set. Is that accurate?
So the teeth that have not been chewed on, have not had occlusal or chewing pressure, those teeth are way easier to extract. So oral surgeons, especially here in Utah, a lot of kids leave home at 18 or 19, and who
Right.
knows where they're going.
Right.
Which is so the percentages here in Utah are higher for wisdom tooth extractions for that reason.
Yeah, that's kind
You
of a
know,
classic
you're
thing. If someone's going on a
yeah,
mission, they get the wisdom teeth taken out.
yeah. If you're going to Zimbabwe, if there's a question about that, you don't want them extracting those wisdom teeth. Um, and so in that case, I am a little more proactive on which ones we take out. But more and more, I'm telling them, don't worry about it. You know, that you're
Interesting.
you're going to be fine. So
Yeah, that's kind of like a said thing. You just,
yeah.
like I mean,
Well, it's
honestly, our bishop is a dentist, and
mhm,
and that's one thing he does for missionaries. He's like he does their wisdom teeth for them, and so
yeah, yeah, yeah.
I
as they
think
get
we
It
should
there's
be
as they
saying
get
that, otherwise we're going to have people moving.
oh,
yeah, you're gonna have an influx.
move into our neighborhood.
Yeah, yeah. No, it's there's like 3 questions on their dental form about wisdom teeth.
Yeah,
Well, and I know
Um,
he will say like, yeah, we need to get out these two, but not these two. And so I know
yeah.
he's is pretty conservative about that and not just jumping it into something that,
Mhm.
you know, everyone has to get it done, whatever. But, you know, I just know anytime you start to do anything with a tooth, I saw it with my own eyes with being a dental assistant. It is just you start to get other problems that can happen, when you have get crowns, root canals, all this type of stuff. There's other things that start to affect that tooth, and eventually it's like you're going to lose it or something's going to happen, that it just. And so I'm always like, keep your tooth structure as much as you can, because that's the
Yeah,
most natural. And you're not going to see, though, if you place a crown on there, eventually the gums start receding around it, and then you're having a more exposure of that, and so then that causes to have more decay, and then all of a sudden now you're pulling out that tooth. And anyways, the infections and stuff can start to happen a lot more if you don't have that tooth structure around there.
Correct. I joke with my dad before I left on my mission, I had 2 root canals done. And I never had a toothache. I never had any pain. And I joke with him, he only knew I had 2 cavities and he only knew how to do root canals. So I had 2 root canals done. That's what I joke with him. I have no idea. If you would have shown me the x-rays when I was 18, I would have known nothing about it. Um, but yeah, as soon as you cut a tooth to put a filling in it, you've started the time clock because that's going to break down because we're asking this material to hold up in a horrible environment. And it's going to break down, and then it's going to be a bigger filling, and yes, those steps just it starts down that road.
So if you have a cavity, is there a way to take care of it naturally so that you don't have to
So,
do,
mhm,
I mean, not necessarily a root canal, but so you don't have to do like a
mhm.
filling? Is that even a possibility?
Yes, the smaller it is, yes, the more chance there is.
Okay.
So yes, so the hydroxyapatite toothpaste, and we'll have patients, that have clear trays like retainer trays. We have them put that hydroxyapatite inside of those trays and sleep with that. We'll treat those areas with
Is
ozone.
that all the time, or is that something that they just do for like a couple of weeks and it takes care of it?
No, you've got to do it for a couple of months at
Oh, okay.
least.
Okay. But
There's got to be
once
quite
you're
a bit
through
of
the process,
consistency.
then that cavity is generally
It's
good.
it it's yes, you can arrest a cavity.
Okay.
My belief is you're not going to regrow any tooth structure. So if there's missing
Understood.
tooth structure,
Yeah.
I don't believe that's growing back.
Okay.
You can reharden it and remineralize it. So it really comes down to the pH in the mouth. If your mouth is below 6.8 in a pH scale, the minerals are coming out of your teeth. If your mouth is above 6.8, then the minerals can go back into the teeth if they're there. So creating the proper systemic environment of acid base and having the right minerals present.
Interesting.
So do you then have them hydroxy
Appetite.
appetite, is that what it's called, right? So you have
Yeah.
them like do this trays, and they do it for a few months until it's, and then do you go back over with a composite on top of it
To
to
seal it or
build,
Mhm.
to
something.
seal it back up, or
No, leave it. You can put just like a sealer, but if you're going to usually the ones that you're doing this remineralization on have not lost enough structure that there's room to add something to it.
oh, okay.
So you'd have an odd shape there. The hardest thing is in between teeth when there's a cavity in between teeth. Getting the hydroxyapatite into there. We do have tips where we can put the ozone gas in there and kill all the bacteria in the area, and then give that tooth the best chance possible to remineralize.
But that's where most of your cavities are, aren't they? Aren't a lot of your cavities in between the two
Most of
teeth?
them are
Because
in
that's
between the
kind of
teeth. Yep.
right.
Because people don't floss.
People don't floss.
Hey, I brush 3 or 4 times a day. I do say that. I do
Per-
that. Yeah.
Perfect.
So let's kind of go in because one of the big things that people have questions on is if they do have the amalgam fillings and things of that
Hmm.
nature. What's the process of getting those taken out? Because I know that if you just go to I don't want to, we'll just say a regular dentist, they're just drilling them out and everything like that. The thing I was explaining biological dentists, they're like in a hazmat suit taking that thing out. So kind
Hmm.
of just really quickly kind of explain the importance of why doing it correctly is important.
Yeah. So with the mercury fillings, there's 2 times that there's a lot of exposure. The first one is when it's put in, as you experienced when you're mixing those, right? Because you've got the fresh mercury. When they're put in, and then when you take them out, because yes, if you're cutting it now, you're heating it, and so now it's off gassing a whole lot more. So the process is, and this is the IAOMT protocol. The patient has forced oxygen. So some patients will do laughing gas, but some oxygen source over their nose. They're gowned. We put drapes over their head. hair and gown them down to their ankles, and then we use what is called a rubber dam. Um, so it isolates just the teeth we're working on. So you're not swallowing any of it. You're not those chunks and pieces aren't going into your system. And then we
And
use
I did see some amalgam, like from, a long time ago, people going down their throats, which is
oh, they're
not,
swallowing it all the time if you're
yeah.
not putting a barrier there. Yeah, for sure. Which and uh then we call it snuffleupagus. It's a huge suction that we put right underneath their chin, and it's got a bunch of filters, so it's pulling all of those gases that are coming out, running it through a series of filters, so it's not affecting the rest of us in the room. My assistant and I were wearing extra masks and gowns as well as we when we take it out.
Yeah, you look like a hazmat cleanup kind of
Yeah,
thing. Yeah.
yeah, yeah.
Well,
It's a
I
different.
remember seeing a YouTube video. It probably got fairly popular, probably about 10 years ago or so, and it just
Mhm.
showed how when they were drilling it, the gases, they had some
Yeah,
kind of thing that, and you don't see that if you're just regular, but they
yeah.
had some kind of filtration on
Like
on
a
the camera.
screen, a
Yeah,
filter
and all of a sudden
screen.
you see
Mhm.
that going everywhere, and it's going down there
Yeah,
when they're breathing it and everything. It's like, well, that's
yeah,
why people have issues, because they get them taken out improperly, and all of a sudden
yeah,
6 months later they have all these health issues they had no idea about.
yeah. Yeah, the video's by Tom McGuire, Smoking Tooth,
Oh, okay.
and he actually shows a just a tooth that has a big mercury filling, and they put the filter over it, and it's outside of the mouth, and you can see the gas coming off it at room temperature, and then he brushes it with a toothbrush, and the gas increases coming off of it. So every time they're heated, you eat something hot, you brush it. Like like if someone has amalgam mercury fillings in our office, we don't polish them because you're just creating more gas.
I didn't know
So
polishing was a thing.
Well, you polish them when
uh,
you're doing the
a
cleanings and
cleaning.
stuff. Yeah.
Oh,
So
okay,
so
okay.
he doesn't get cleanings, nor does he floss. Okay, we've established this. No, so in the polishing, the prophy in the hygiene appointment, we don't polish the mercury fillings because of the extra heat that it generates on them, and now more of that mercury gas is exposed.
Mhm.
So so yeah, it's a process. And oftentimes we'll take x-rays to verify that we've got all of it out. Uh, after we've done our initial removal, the goal is to cut the mercury as little as possible. So we have some techniques where we do that and we take it out in chunks as much as possible, so that we're cutting it as little as possible, and then replacing it with good materials, that whether it's porcelain or a porcelain based composite.
So one of the things that people, I mean, let's just be honest, for whether it's my care, your care, whatever, dollars and cents are an issue for people
Hmm.
with stuff. So to do like an amalgam tooth, what's an approximate? You don't need to give us your fees, but approximately, like, is it a $200 item? Is it a $500 item? What's kind of the idea of that?
That's going to vary a lot, to be very
Okay.
honest with you.
Okay.
I do take some insurances, and so the dentistry, if you are on one of the couple of insurances that we take, your insurance will pay their 80% for that.
Oh, so
We
they will
charge what we
without any issues. They'll allow that to happen, huh?
oh, I we can prove there's decay underneath that
Okay.
mercury every day.
Okay.
It's black every day, and what I charge for, we call it patient protection. So there's an extra fee per appointment for all those barriers that we do.
Okay.
That's how we do it in our office.
Hmm.
And that's it's about $300, I think, per appointment for the barriers and all the extra time we take.
Right, right.
Mhm.
And then is it a fee per tooth kind of thing?
And
Do you
then it's a
try to do
fee.
multiple teeth at the same time if they have
Yeah,
multiples?
yeah, yeah. So depending on how many they have, how big they are we doing a crown? Are we just putting fillings back in? We might do one side, or we might just do one quadrant. Like some people have four teeth in
Hmm.
every quadrant that have mercury fillings in them, so we're going to do those in each quadrant.
Right, right.
So
Just because.
I did get all of mine taken out
Hmm.
just because I've suffered with some autoimmune stuff, and I was like, I knew getting into it that we needed to do something like this, and so I went in and I got them all taken out. And then I also I got an inlay put in because I had a tooth
Hmm.
that had a lot. And I did not want to get a crown. Like I said, I just do
Yeah.
not want to get a crown. And so they put an inlay in. And, I did have another tooth, because most of the things that happened to me with my tooth structure was probably before I was 15 years old,
Right.
things
Yeah.
when I didn't really know about a lot of stuff then. And so now it's since I'm, 50, I'm getting 53 here, then it's like creeping up on me. And I got another broken tooth, and I told the dentist, I'm like, I'm not getting root canal and I'm not getting a crown. So
hmm
if you can fix it and put some composite on it, that's great. Otherwise, I'm probably going to have to go someplace else.
Yeah.
you know?
And you've got to stand up for yourself. I had a patient today. We've her insurance changed and she went somewhere else and they're like, and she came back today. She's like, they want me to do this, this, and this, and this. And 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 I talked with her. I'm like, you just stand up for yourself. You don't have to do what they tell you to do. This is your body, this is your mouth. Advocate for yourself and just do what you feel like is best.
And I think that's probably an important message to end on here, is that we have to stand up for ourselves. We have to
hmm
educate ourselves. We believe with our conference it's knowledge, empower, and elevate. And now that you have the knowledge, there's more things that you've understand, then you can empower yourself with this, and then include all the things that you have done, and because of that your life will be elevated. But it starts with you, and you deciding that what is it you're going to accept and what is it you're not going to. And like I said, I stood up and I was like, I am not going to get a root canal and I'm not going to go to crown. So we're going to have to do something here. Otherwise, I'm not going to do this, right? And so we have to be the ones in charge of our health and what is
Yeah.
it that we're going to be accepting of.
Yeah. Until you find that practitioner that's aligned with you, right? And then you feel like, hey, we're on the same page.
So where is it people can find you at?
So we have a website, larsenfamilydental.com. My office is in Bountiful. Phone number is 801-295-8881. And yeah, like I said, we take care of all these infections stuff, the mercury, we do a lot of airway treatment for kids and adults. Uh, they sleep dentistry, they call it. So people with CPAPs, a lot of them we
Yeah,
can
that's become a
a
big
lot of
thing in dentistry too. Yeah, this
it
sleep apnea
has.
stuff. Yeah.
And because there's so much that we can do in the mouth with lasers, with expansion, different things like that to
So one
help
question
improve
I do have
those
for you,
those areas.
some of our listeners aren't in this area. How would they go about trying to find a biological dentist? Is there a biological dentist, website for people that have gone through
Mhm.
their program? Where would they go to find that? That's someone in their area.
So there's really two, there's kind of three. There's IAOMT .org and IABDM, both biologic dentistry
Like certification kind of things.
certification
Okay.
groups.
Okay.
Yep.
So
And
if they're
they
not in
they
the
have
area.
their own mercury safe techniques. They're very similar.
Mhm.
And the same philosophy, no fluoride, no mercury, and all of them getting into the science of, in fact, IAOMT just put out a focus paper on root canals and the cavitation areas, and really put the science together on those. So that's a great resource.
Okay. Well, thank you so much for your time, Doc. We appreciate you being on our podcast, and we're grateful that you were a part of our conference. Unfortunately, you weren't able to be there, but your staff
I
was there,
know.
being able to promote your thing. So hopefully, you got us on the calendar for next year. So because we do appreciate it,
Yes.
and we do think biological dentistry is very important. So in Utah, just a quick to end, how many biological dentists would you say there are in Utah? Because there's
Oh,
thousands of dentists. I mean, there's
oh
more
yeah.
dentists in Utah per
Yeah.
capita than I think anywhere else. But of those
Yeah.
thousands, is there like less than 50? Is there less than
Yeah.
25?
Probably I would say less than 20 that are really doing it,
Okay.
that are
So
offering
it's
those on
so it's
PRF. It's
it's
a
less than
niche.
one per, yeah, yeah, okay. So
Mhm.
so not they're not that common. So if you are trying to find someone, you're gonna have to look a little bit. All right.
Yeah. And it's more than just no fluoride. no metal. There's a lot more that goes into it.
Right.
I have a naturopathic dental degree. I've all these other certifications, and so
Awesome.
it's got to be someone who's staying up on it, not just no fluoride, no metal kind of thing.
All right. Well,
All
thank you.
right. Well, thank you for being on today, and we
Yeah.
appreciate all the knowledge you've been able to share with us. I know this is a huge topic, and I'm so grateful that you took the time and you had to go against the grain because you had to go against your dad, and you're hoping you're
He
still in
doesn't
his
know.
will.
Nobody tell my dad.
We're going to send him this podcast.
All right. Well, thank you for being on.
Thank you.
Your health journey is between you and your healthcare providers.
So remember, this podcast is for educational purposes only.
To stay up to date, visit us at BeHealthyUtah.com.
And please subscribe to our newsletter where we give additional health information, health tips, as well as recipes.
Thank you to our 2026 sponsors.
We truly could not do this without them.